helps us to breathe and talk, which is very important. If anyone's ever suffering with some respiratory issues, which some are now, unfortunately, you might find that your breathing is affected, some shortness of breath, and also you're unable to speak. So we really want to be supporting our respiratory system. It maintains proper pH in our body. So I know people are always talking about that. So the lungs have to do with that as well. And it supports our cardiovascular system. So any shortness of breath, you want to think of two parts of the body to look at, and two conventional doctors in medicine. You want to rule out anything that could be going on with the heart and go see your cardiologist. And you also want to think with shortness of breath about your lung health. So you want to go see a pulmonologist. So I might be, during this talk, I might be referring to lung health, and I might call it pulmonary health. They're the same thing. Okay, so those are two doctors that you do want to see if you are having shortness of breath. And then another quick fact is that preventative measures do keep our lungs healthy. So everything that I'm talking today, I know a lot of people were asking me some questions before this webinar. Should I be doing all these things to support my lung health if I don't have any acute issues? Yes, you can always do preventative measures to help your lung health. And now is the time to pay attention to this and take action and do all these things to support our lung health. You don't want to, and now's also the time, if you're suffering also, you want to be doing some of the things that I'm saying as well. They can help you, or they may help you. If you're unsure, have a doctor to look at your specific case. But you definitely want to come in with everything that you've got and take action before you're feeling unwell. So that's where naturopathic medicine shines. And I encourage everyone to listen to your body. So the body speaks to you in three ways. It whispers to you, it talks to you, and then it screams to you. So if there's any imbalance, the body's trying to tell you something. The more in tune you are with it, the more that you can listen to it. If it's whispering to you, sometimes you can miss it. And especially if there's chronic illness and there's other things going on, you might not get the signs. And then it talks to you. You might be feeling a little bit worse, but you're still, your vitality is still there, and you can still make some changes. But if it's screaming at you, you're going to be in worse shape and not feeling too well. So you definitely want to take action right now. So the importance of the lungs, we require oxygen, clearly, food and water to create energy. So oxygen has to be brought in from the outside air and carried into each cell. So think about this. Every moment we are connecting with this beautiful world. We're putting the world inside of us with each breath. So I just wanted everyone to think about that and how important that is. So I think now is a good time to take a nice deep breath in. And exhale and let it go. So if everyone can take some time now to take some deep breaths, that's going to help to calm down. You're going to be able to get all this information, digest this information with a clear head, calm body, calm nervous system, and deep breathing helps you to do that. And that deep breathing is one of the best things that you can do for yourself. If you're feeling stressed out, it's one of the best things you can do to support your lung health and to get all the oxygen that your body needs and to circulate it. With Chinese medicine, we talk about the lung qi, to get it everywhere that it needs to be. So when you think about with every breath, we're connecting with the world like that, and we're bringing the world into our bodies. So that's nature, using nature to nurture ourselves, right? So that is just the basis of naturopathic medicine. It's so beautiful and it's so wonderful. And briefly, I'll talk about this also, why this is so important to me. So I had mild obstructive lung disease that I was suffering for most likely most of my life. I didn't find out about it until a few years ago. And my body was doing just that when I talk about it, whispering and talking to you. Luckily, I caught it when it was talking to me, but it was whispering to me for a long time. For just the sake of time, I won't go into too much detail with it. But when I found out about it, I was doing a workout on a really high incline. It was a cold winter day. I'll never forget it. And I was on the treadmill, and suddenly I had this cold sensation, a shortness of breath. And it got lodged right here, right in my sternum. I'll never forget it. And it was painful. And I remembered it was very cold. And I would just rub on my sternum. I was on the treadmill. And this happened within 30 seconds of my workout, very quickly. So I got off, I put the treadmill down to base. I mean, I almost fell off the treadmill. It was that intense. It felt like someone had just like, punched me right in my chest. And I had the shortness of breath, and it lasted for 2 days. I made an appointment for the cardiologist. And by the time I got to the cardiologist, though, the shortness of breath was gone. And they said to me, "You're healthy. Everything looks normal." I insisted that they do a full workup. So I always encourage my patients, I encourage you to be your own health advocate. If you know that something is wrong, ask questions, find a provider who will listen to you, ask for the testing that you want, so that you can get the answers that you want if that you truly believe. I always feel like people have an innate sense that there is an imbalance in their body. So go out there and ask for what you want. It's your own health. So they did a full workup. I was fine. So then I said, okay, next stop is the pulmonologist. So I go to the pulmonologist, and he goes again. He's, "Well, your lungs are clear." At this point, I had no shortness of breath. He goes, "You're young, you're healthy." And I said, "Something is wrong. I had shortness of breath for 2 days. There's something wrong. That wasn't correct. I knew that it wasn't right." He goes, "Okay, you want to get a pulmonary function test?" So I said, "Yes, absolutely." And he kind of said it very like, we could go either way. And I said, "Yes, absolutely. Let's do it." So we did it. If anyone out there has had a pulmonary function test, feel free to chime in. So I did it. With me, I was in there. You feel like you're launching to the moon. You're an astronaut going to the moon, right? So I'm in this little capsule, and I couldn't breathe. I thought that the machine was broken. I remember knocking on the door and saying, "There's something wrong here. I think we don't have enough oxygen." So she's checking the machine. It took forever to do this test for me. Lo and behold, I get the results. The doctor calls me, said, "You have mild obstructive lung disease." So it wasn't the test, it was me. It was my lungs. And I was like, wow, okay. So I said, what can we do here? And he said, "Well, it's probably going to turn into COPD. There's nothing that you can do for it. I would get a pulmonary function test every year." And I had known from med school, I remember learning about something called inhaled glutathione. So I knew about this natural treatment, and I asked the doctor if he would let me do it under his supervision. He wouldn't do that. And to his credit, he didn't know about it. He had never learned about it, but I had learned about med school. So I went to doctors who can help me. I got the treatments, and I did it for 5 months. I went to another pulmonologist, had my pulmonary function test, and I'm happy to say that my lung condition was reversed, and I've been breathing fine ever since that first treatment, actually, that I did of that. But I remember, what it feels like to have that labored breathing, and it is no fun for anybody. So I am very committed to my medicine and helping to heal the lungs naturally, because doing a lot of these things that I'm going to talk about today also helps to support my lungs, because I know that I was predisposed to that condition, and I don't ever want to have that to come back. And I'm really grateful that I reversed that condition, concerning what's going on in the world today now. So I have a question here. Why should you exhale through the nose or mouth? So that's a great question, Rebecca. So that has to do with body warmth. So I talk about this. I do talks at the Salt Cave. That's right down the street from my office. And the Salt Cave is really great for respiratory issues. So if you have a Salt Cave near you, I encourage you, once this is all said and done, to make it a habit to go into the Salt Cave, because it is really great. It's anti-inflammatory. And I'll go into more benefits of the Salt Cave. So if you choose to just inhale and exhale through your nose, you're keeping warmth inside the body, circulating in the body. So if you tend to be cold and you want to keep your body warm, then I encourage you to breathe through your nose only and keep the mouth sealed. If you want to release heat from the body, then breathe in through the nose and exhale through the mouth. So I hope that helps to clear that up. That's a little tidbit that you can take with you. Okay. So thinking of the lungs, think of the lungs as your first line of defense against infection. Okay. There's two things to avoid when it comes to lungs. You want to avoid inflammation, and you want to avoid thickening of the mucus. Okay. So inflammatory lung disease, we have cellular damage that happens and injury. So oxidative stress is an issue, and that decreases our antioxidant defenses, right? So mucosa is also a first line of defense. So we always hear about mucus, right? So, but it occurs naturally in our body, and it's a protective lining. So think it's protecting our nose and our throat and our lungs. But this mucus does get produced in response to infection, inflammation. So think about if you're prone to allergies and you get some extra congestion and mucus, this is part of this natural response to it. If you have a chronic issue and you're getting chronic mucus buildup, this is where it becomes an issue because it's starting to build up and stagnate and thicken, and you get more and more of this mucus. You want it just at the right amount, right? Just like everything in the body, we want everything balanced out. So phlegm is this type of mucus that's produced in the lungs and in our lower respiratory tract. Okay, and so back to the mucus wanting just enough for it. So with congestion, a major dysfunction in the body and a major culprit there is too much mucus. Okay, so we want this mucus down. So what's the number one bad guy? I want to know if anyone can guess what I'm about to go on a huge rant about that is a contributing factor with mucus. Now, there's a lot of them. There's contributing factors like any kind of irritants, like cigarettes, pollutants. Yes, Tony Ann. Tony Ann wins the prize. Dairy. I am about to go 8 right on dairy. Okay, so there's no useful purpose for it, but it's everywhere, right? Dairy, everybody knows, right? It's inflammatory and it's addictive. Okay, and it's nasty. So dairy's nasty. It's this goo when you think about it. In Chinese medicine, we think it's damp. Yes, it's for baby cows. What are we doing eating them? We are not calves. We are not trying to become a 400-pound cow, right? I have never had, and you know what? Then I will take back everything that I said, but I have not yet had a patient come into my office and say, "Hey doc, I would like to become a 400-pound cow, grazing in the fields, chewing grass all day." Hasn't happened. So until I see that, there is no reason that anyone should be having dairy. No human should be having dairy. Breast milk is necessary for infants, and that's coming from humans, right? Breast milk, and that's what we need. But we are not trying to become a cow, and that's what it's for. That's what it's necessary for. So no animals consume dairy past infancy. All the other animals know not to do it. They know what it's used for and when to do it. So, there's a lot that goes into this, the treatment of the animals. It's really, really a sad situation. But why do we love it? So there's reasons why we do love it. And it attaches to opioid receptors. So casein is a protein in dairy, and it triggers the brain's opioid receptors, and they release opiates called these casomorphins, which are addictive, and they have a calming effect. So if this gives I love to always understand for myself. So I hope that this explains also a reasoning as to why. So there's that addictive factor, and they do have that pain relief factor. So you have to ask yourself, and stop yourself. So this is a good question to say. So, and dairy can be a tough thing. So I don't want you to feel bad if you're having dairy, but I want you to understand how this plays such a factor in affecting lung health, and it can deteriorate lung health because it thickens the mucus. That's the issue with dairy. The dairy is not creating the mucus, but it's thickening the mucus. And that's a problem with inflammation that affects the lungs, which affects our respiration. So all dairy. So is this for goats and sheep's milk? Yeah, I'm talking about the cows just to really bring home a point. But yes, it's the same thing. We are not trying to, we're humans. We should not be having anything else besides breast milk as infants. Okay. So what was I saying? So ask yourself with the pain, stop yourself and just have a moment to check in with yourself and say, why am I having this dairy? And are you feeling pain? Is it physical? Do you know where is it your elbow? Or is it emotionally? Are you emotionally feeling pain? Are you feeling stressed? And that's why you're reaching for it. And if you are, that's kind of the reasoning behind it, because it has that relaxing effect on it. Okay, similar, and it's very addictive. So stopping yourself and understanding that, and that's where there's other factors that can come in. You can do things that are relaxing, like a deep breathing technique, anything that provides you stress relief, exercise, anything like that would be really good. But avoiding dairy, what do I see all the time? You can keep your asthma under control. You avoid the dairy, you decrease the inflammation, you decrease the congestion, and the congestion clears. It kind of just goes away. People go, oh, I can breathe better. Pain, and that's the funny thing about pain, is that you decrease this inflammation and then the pain goes away. So all this time you've been eating this dairy because it makes you feel good and has this pain relief. But in the long run, you're creating more pain because you're creating more inflammation by eating the dairy. So quit the dairy, and then you calm down the inflammation, and then you're going to have less pain, right? And things are going to be able to flow better. So it makes sense. Okay. And then energy gets better because this dairy, it's damp and it's heavy. And then you're just kind of, you create this dampness and this heaviness in the body, and then you just don't have energy. You know, you just feel like a little mushy, a little gooey, just like the cheese that you're eating. So, you know, you look at food, you go, do I want to feel this way? No, you don't. Okay. So, if anyone has any other questions about dairy, I'm happy to talk about that, but it's never going to be anything good. So, I hope that understands. So other things, now we're going to get to some of the main points I was talking about. So with nutrition, other things to avoid is gluten. And I hear people say this all the time, but I don't have celiac. I can have gluten. Not true. Gluten is inflammatory. Gliadin is a protein in gluten, and it's gluten mainly in America because of the way that it's processed. So unfortunately, for all these years that they've been processing the wheat, it's inflammatory, and there's chemicals in it. It's not organic, it's not GMO, and it's overly processed, and it's very inflammatory. So avoiding gluten, and you could feel a lot better too. Congestion clears, mucus clears, inflammation goes down. And sugar as well. So sugar is a major culprit, right? Really addictive, sugar's inflammatory. So that's not helping either. So avoiding those guys are going to help you. One thing that you can have, and this is my little trick, any of my patients who know me, and we're dealing with this, is my favorite go-to is having a boiled Asian pear. Has anyone seen these? They're usually in this, and they're not really in season now, so in the later fall, but you might be able to find it somewhere if you go to the Chinese markets also. But they're in that styrofoam, and they're a little rounder. They're really crispy like an apple, and they taste like pears. And boiling this pear helps it dissolves mucus, and it clears congestion. And it's really yummy to eat, and it's full of fiber and antioxidants and vitamin C and vitamin K and potassium. So all these good things, but it really calms down. In Chinese medicine, we call the lung qi, and that's what the boiled Asian pear does. And what is it? It's the color, it's a white. So the color of food that supports the lung in Chinese medicine are white foods, and a boiled Asian pear is white as well. There's something called doctrine of signatures. So that's where you use, well, food is always as medicine, but doctrine of signatures means that the herb or food kind of resembles the organ that we're trying to support. So with white foods, that's the color for the lungs, and then also foods that look like lungs. So things that support lungs also. So lychee, if anyone's seen those, so when you get through the coating on that, which is kind of like a pinkish reddish, it's a white fruit inside. So that helps support the lung qi. And I think it's so hydrating also. So it's really good for the lungs. Garlic, you dice that. And think of garlic, they're just like these little lungs hanging together in a pouch. You dice those up. And you want to eat the garlic seconds after you dice it up, because there's something called allicin in it, and that's the medicinal property in there. And it's antibacterial. Oh, one of my favorite antibacterials and antivirals. You take that with a scoop of nut butter. For anyone who eats honey, you can have that with a scoop of Manuka honey. Manuka honey is a powerful antibacterial. So that's really great now if anyone's battling any infections. So I love my diced garlic. Onions are white, so those are really great at supporting the lungs. And dragon fruit, has anyone seen that? Sometimes called pitaya. It's white with it kind of looks like a vanilla gelato with these black seeds in it. It's so hydrating and delicious. So that's another great white food that you can eat. And jackfruit also. Jackfruit, and it looks like little lungs. When you cut it up, you've seen pictures of it. It's really good. It takes on the flavor of anything. So that's a good, nice meat substitute. I really love how jackfruit tastes. Yes, or yeah, garlic and onions. Yeah. Yeah, turnips are good. Yeah, that's a great root vegetable. Yeah, so turnips would be fine too. And tons of fiber in that. So love it. So, and foods rich in vitamin C now. So a lot of people, places that vitamin C is tough to come by as a supplement. So food is medicine. So get that from your food, right? Tons of vitamin C in all the fruits, oranges, mangoes, all that, those yummy guys. And then, think of all foods with antioxidants and flavonoids. So any of the colorful foods. So, eating the rainbow. So a variety of those colors are really great. And again, we're talking about, oxidative stress affecting the lungs. So all the antioxidants are really nutritious and good for the lungs. Organic sprouted bread. Okay. So anything, yeah. Thank you, Nadine. Anything that has gluten in it, no matter how nutritious and healthy the label makes it sound. Again, some people gluten can be more inflammatory to them than others. So again, this for each person. If, let's say, you are really good about everything, but you like to have your organic sprouted bread here and there, and your inflammation is under control, then go for it. But I'm here to tell you that gluten is very inflammatory. And corn is one of those GMO foods. So not one of my favorite foods to eat, not much nutrition in it. And, one of those indigestible foods that kind of come out in your poo and you see it. So I don't love corn for those factors. Okay. And then hydration. So our lungs are mostly water. So drinking water and staying hydrated, that helps to move everything. And while I'm saying that, I'm going to have a nice sip. So I hope everyone can have a nice sip of water too. Okay. So water keeps the airways clean and clear of mucus, and it prevents that inflammatory buildup. But what you want to do is have warm water. And some warm water with lemon, because then you have the vitamin C in it. So the warm water loosens any buildups. It opens up the lymphatic system. Our lymphatic system is our drainage system, and a lot of toxins can get stuck there, and you don't want that toxin buildup. You want it open and clear, okay? And this warm water does that. It improves circulation by expanding the arteries and the veins to carry blood more effectively through the body. So you want that warmth to do that. So rule of thumb always, to have warm water. And filtrations. Okay. So eggs and water. Yeah, I'm gonna hold those. I'm gonna write those down so I don't forget about those, and try and get to them towards the end. Okay. Okay. So you want to carry it forward. So you want that expansion with circulation. So pretty much rule of thumb to have warm liquids in general. And if you have water, avoid anything cold, because what does it do? Cold constricts, and then things get stuck there. You don't want that. You want everything open, loosey-goosey, right? You want good vein, you want good flow throughout the body, good qi, right? Good qi in Chinese medicine, things are flowing. That's what we want, okay? So the warmth of the liquids, warm water, warm teas, do that for you. Regardless, especially if you're sick, think of that. You always crave soup and crave teas because we want that warmth. We want to detox. We want to get all these toxins out of the body. And then that warmth also brings, we're also able to, when we're drinking those warm, anything that helps to the body to sweat. So if you're drinking warm and it helps you to sweat, that's a good thing. And then you can reduce the toxins. Okay. But not necessarily. You could just drink the warm water, to sweat. That's fine also. And this warm water helps to decrease stress by improving the nervous system function. So just by drinking that warm water opens things up and calms things down, because that constriction can be very stressful. So you drink those cold liquids and it could be like this. So really think about warm liquids in the body. Teas. So ginger and cinnamon are some great teas to opt for, because ginger and cinnamon are warm herbs. So those are some good options to think of also. Some good fats. So omega-3s decrease inflammation. So thinking of some good options there, ground flax seeds and walnuts. So herbs that also support your lung support. So thyme, oregano, sage, peppermint. So those are some good herbs. And there's tons of herbs out there. So those are just a few that I picked out. So what things that you could do. So hot steam, speaking of drinking those warm liquids, doing hot steam. So taking a nice warm shower. And if you're feeling sick, hop in a shower a few times a day to just open up those nasal passages. Sorry. That sounded like I just kind of snore. I was just trying to take a nice deep breath for you all. I think that came out the wrong way. But you're in the steam, and the shower just really opens things up. So that warm air. So drinking the warm liquids, being in those warm showers are really good. Hot steam you can also do if you don't want to hop in the shower. Use this with caution. You'd have a boiling pot of water and you turn the heat off. Okay, so there's no bubbling water, but you've got that steam coming from that hot water. You put a towel over you and you just stand over. Make sure you're able to stand sturdily. If you're not, have someone watching you. And you just stand over that steam from the water and you just let it come up. You can throw some essential oils. I love eucalyptus oil in there. And you breathe that in, and it's really good to just open up these passages again, clear, and you want to think about thinning the mucus. That's what it's doing. You can also, if you're unable to do those things, you put a warm washcloth on your face, keep your head elevated, and just kind of put that on. That warmth will also try and open things up, if you want to put it around your throat or whatnot, by putting that warm washcloth around you. Doing things like nasal rinses and a neti pot. I know those aren't for everybody, but if you are able to do that, those are great. Lubricating the nasal passages. So using sesame oil. This is something that I've learned with Ayurvedic medicine. Sesame seed oil has lots of benefits for all the 3 different doshas, but using the sesame oil to lubricate the nasal passages. So this is one of them that I have, something called Nasya oil. But any sesame oil will work. This one has a nice blend with eucalyptus in it and skullcap, olive oil, so different herbs. That's a nice blend. And you put that on a Q-tip and you just simply massage it right into your nasal passages. And that's really great, at supporting you. You want to think that you want to moisten those passages, again, thinning the mucus, but still having proper lubrication throughout. And then essential oils. So one of my favorites is eucalyptus. I have my whole stash that I'm looking at over there. I have my essential oil diffuser going on. Again, you can put those essential oils in the shower. I've dripped them in the shower, and sometimes you might get a little oil buildup. So if you want to avoid that, you can put the essential oils on your hands and just breathe into them is really good. Just be mindful that they're on your hands. So make sure you use soap. If you're going to wash your face, you don't want to get the oils in your eyes, but always that essential oils can be used. You can have it used as a roll-on, and then just smell it whenever you need. Chest and back rubs with a good carrier oil. So the carrier oil dilutes these essential oils because they are really strong, and it spreads it over a large skin area, and it helps the absorption. Another great spot on the body to rub essential oils on, and that carrier oil, is on the sole of your foot. So it helps, you put it on the bottom of your foot, and also just like our feet, our ears, our hands, they're all microsystems, and they're all connected to the body. So all of the organs are connected with your foot. So if you think of massaging kind of right in the upper part of your foot, right under like that, that area where the lungs would kind of be represented. So let's say my hand is a foot, and then so the lungs would be like right here, if that's making sense. But you just rub that essential oil underneath the foot. You can rub it under the whole sole of the foot. And that helps to bring energy down. It really clears congestion. It's really great. And then the wet sock treatment. So if anybody saw News 12, I talked about this a few weeks ago, and I'm happy to send anybody my handout for it. But the wet sock treatment is one of the oldest and greatest forms of hydrotherapy. And it's really good at clearing congestion and bringing energy down, naturally decreasing fever. It's great for kids. We call it the magic socks, and they love it. So all you do is that you take a nice warm shower. Ideally, you want to do this before you go to bed. If you're feeling sick, sometimes one night is all that you need, or if you do it 3 nights in a row, that's optimum, if it's what you need. And you take a nice warm shower, or just wipe down your feet, or you just put your feet in a nice warm bath, dry them off. You have 2 types of socks on you. You're going to have cotton socks that are just ankle high, and then you're going to have thicker socks, like a wool blend type of sock that comes up to your shin or higher, that are dry, and you're going to put on over the cotton socks. So what you do is you wet the cotton socks under really cold water, and then you wring them out really well. So you don't want them dripping, but you just want them wet and cold, and you put them on your feet. You're going to feel a little zing, right? It's going to be really, really cold, but it's also going to feel really good. And then you put those dry socks over it. Okay. And what this is doing is this is increasing circulation. And so it's getting all the blood moving. It's opening up all the vessels to get the blood circulating. And it's also bringing energy down because your body is doing everything it can to bring itself back to homeostasis. Your feet are cold. They want to be warm. So the body's like, we got to get warm. So it's getting things moving. It's boosting your immune system. So if that's something you need, then this will help you. And it's also bringing down fever, but naturally. Okay. Fever is not, you don't necessarily want to be on high alert with fever. The fever is the body's natural response to fighting an infection and bringing your body back to balance and having you sweat out, you know, the toxins also. So you want to naturally decrease this fever. And that is what the wet socks do. It is awesome. So I highly recommend it. The salt caves. So why do I love the salt caves so much? So it's Himalayan sea salt in these salt caves, and it's amazing. The one that I go in is amazing. It's all reliable. There's 11 chairs in it. It's these zero gravity chairs that you just relax into, and you just lean back. Everyone's meditating. It's all dimly lit, which is the light, the glow of the Himalayans, of the salts all around you. So they have all the Himalayan sea salts that are imported in, and it's all the walls are sea salts, all the floors are sea salts. It's just the ceiling that has the illusion of looking like sea salts, and they also have the lights up there. Ugh, it's just absolutely divine. It's awesome. And everyone relax in there, and then they have a and then I just do my talk in there, and you just relax. And so what you're doing is that you're inhaling, they're pushing some Himalayan sea salts through a vent that comes through also. So you get some extra Himalayan sea salts. And there's 84 minerals that are in Himalayan sea salts naturally. So your body is naturally absorbing what it needs. And any minerals that you're deficient in, you're absorbing them through those Himalayan sea salts. It's awesome. The Himalayan sea salts are anti-inflammatory, they're antibacterial, they're antiviral, they're antifungal, they're anti-everything, and they really help to support you. Yes, handout for the wet sock treatment. Yes, you got it. And so it's wonderful, and it's really relaxing. I just absolutely, and you have energy, and because especially during allergy season, if anyone is suffering with asthma, they come out of there, or a cough, a crazy cough, you go into the salt cave, you're going to feel better after a session in the salt cave. That's why it's so awesome, and it's great for respiratory health. So, and also acupressure points. So these are really effective. So the points here, so generally, so there's something called lung 1 and lung 2, all the acupuncturists out there know what I'm talking about. So lung 1 is kind of, so lung 2 is above it. If anyone can see me, they're right. It's kind of like where there's a triangle on the clavicle here. That's lung 2, and then lung 1 is kind of like right below it. But rule of thumb, what you can do is if you're having any respiratory issues now, any congestion, any cough, any wheezing, you can find a tender point that's around this area. That's kind of what I suggest. And you can just kind of press into these points. Take some deep, yay, Vicky, lung point. Take some deep breaths. And then just exhale and exhale it out. Press into those points. You can kind of massage it. And then over time, what we want is that we want that tender point to kind of not feel as tender. That's the point of doing it. So when you have tenderness, it just means might be a little stagnation. You massage it out, you get the chi moving, and you get that going, and you don't feel that stagnation or the pain anymore. So, okay, so lung 1 is kind of right here. So it descends lung chi. So descending lung chi, right? So we're calming down any cough and wheezing, transforms phlegm. So meaning it's thinning the mucus. That's in Chinese medicine what it means. And it clears heat, okay? And then lung 2, which is kind of right in that triangle point a little bit below it, it descends lung chi as well. So it can help with the cough and wheezing, and it clears heat. So both points can be really helpful. Just figure out which points are tender on you, and they help. Something to have handy is a pulse ox, called pulse oximeter, and go to the salt cave as often as you possibly can, Maria. But it's really whenever you have the time for it. I'm there twice a month at the one that I go to, and I love it. Some people like to go weekly. So it all depends on the time that you have, how often you can afford to go to it. It's pretty affordable. I'm there on Wednesdays where it's half off for there. So it's only $20 for a session there on Wednesdays. But find out the nearest salt cave near you, look into it, try it. It's wonderful. So pulse ox. This is what it is. So you just simply put it on your finger, ideally no nail polish, and you put this on, and you press it, and then it tells you what it tells you a couple of things. It measures the saturation of oxygen in your red blood cells, where hemoglobin has bonded with the oxygen muscles, and it also shows you your pulse rate. So above 95, yay, I'm 99, woo, and my pulse rate is 97. I think because I'm talking so much. So, you know, ideally 100. I have only seen that once in my life. So anything between 99 above 95 is good. If you do have a pulmonary condition, your normal pulse ox might be a little bit lower. It might be in the high 80s. So just check with your pulmonologist, know what your pulse ox should be, and get one of these. This is really good to have on hand now, especially during these times. So you can order it online. You can probably get it at your local CVS or Walgreens. They have them there also. And Qigong exercises. So I'm going to do, yeah, Maria, check out this. I'll go one time and see how you like it. It's great for all the reasons why I said that it was. So, you know, again, everyone has different experiences doing all different things, but I definitely recommend the Salt Cave. Okay, Qigong exercise. So this is what we're all going to do right now. So this is opening up the chest. So you could stand up for the purposes, I don't even think you guys are going to get a good view of me, but I'll explain what you do. So opening the chest. And it cleanses the lungs from any stagnant qi, strengthens the lungs, and it's very grounding. So when we think of belly breathing exercises also, we want to avoid any shallow breathing. So shallow breathing is, you know, when you're breathing and your chest is moving, your shoulders are going up, and it also creates tension in our upper back and our neck. So we don't want to do that. So doing something called deep belly breathing brings this qi down. It's very grounding, and it gets the lungs circulating, uses up all the lungs, and gets the oxygen everywhere that it needs to be, all the way to the base of the lungs. It's really great. So you want to be doing deep belly breathing. When you take the inhale, you expand into the belly. And then when you exhale, you kind of push the belly down. It's a great technique that you can always use. But this Qigong is really helpful too, this exercise. So everyone stand up, and I'm going to do it just so you can see my arms, but pretend that I'm standing, and have your feet hip distance apart, have your knees light, nice and soft, and have your spine aligned, you know, roll your shoulders back, have a straight spine. Again, you know, you want the spine aligned, you want proper alignment in your body, because then all the organs can sit where they're supposed to sit. They're not all crunched up, you know, they can breathe and they're open. It allows for that good flow of qi, you know, all that's good stuff that we want going on. And so that the organs are sitting right where they want to do, so that they can do what they want to do. You want to take your arms and have them facing each other. Okay. So just raise the arms chest height. So I'm kind of like this. Okay. And what we're doing is then we're just going to be opening and bringing it in. So we have these palms. When we inhale, we're going to expand with the palms facing down, right? Inhale. Oh, I really feel that stretch in the lungs. Okay. And then we bring them in, and then the palms are facing up, and then come back to this position, kind of like that 90 degrees, you know, where they're facing. So then again, so we're going to inhale and expand with the palms facing down. And then exhale, have the palms facing up. So it's really good. So again, inhale, palms facing down. And then exhale, palms facing up. And try and think of also, while you're doing that, getting the deep belly breaths. So you can think when you're inhaling with the palms facing down, so the palms facing up and down. So you can always think of having an interaction with the world. So when our palms are facing down, we're releasing, okay? So we're inhaling, and then when we're exhaling, we're having a release, okay? So inhaling, taking things in, and up, we're releasing. Okay, so however that works for you. You know, you can have your hands pace however you want. Just pretty much the motion is that you're opening and then bringing the arms back in. Okay, so whatever is easiest for you to remember. So open, so you're opening up those lungs and bringing it back in. So I hope that that helps. Okay, so now supplements. So has anyone heard of something called NAC. I'm sure you have. So something called N-acetylcysteine. And I'm going to explain how important this supplement is because it's a mucolytic. So what does that mean? It breaks up mucus. It's really important with inflammatory lung disease. So glutathione, has anyone heard of that, is a tripeptide. Glutathione is one of the most powerful antioxidants in the body. Like what I was just talking about, when I reversed my lung disease, my treatment was inhaled glutathione. And that's what reversed it for me. It's powerful, and I love it. Glutathione is so this tripeptide, it's made of glycine, cysteine, and glutamate. So NAC is N-acetylcysteine. Okay, so it's one of those tripeptides in it. Glutathione is intracellular and extracellular protective. It's a protective antioxidant in the lungs. Okay, so with any kind of inflammatory lung disease, there's alterations in the lung glutathione metabolism. Okay, so we have to support glutathione when it comes to supporting chronic lung disease and any inflammation. And if you have congestion and you have a buildup of mucus, if you see a naturopathic doctor, they are going to prescribe to you most likely NAC because it breaks up mucus. And this is why. So, because a lot of times I have patients, they always go, what was that NAC stuff? Why do I have to take it? And this is why. It's really important. It eats up those free radicals. So when we're talking about oxidative stress, we don't want those free radicals roaming around. It's not helping the oxidative stress. And it detoxifies. So NAC is a powerful detoxifier. It detoxifies fat-soluble compounds. It's really important. So with the glutathione, it's in the epithelial lining of the lower respiratory tract. And it is the first line of defense against oxidative stress. So it's really important that you have proper levels of glutathione. And you can't just take glutathione. You can. There's liposomal glutathione. It's expensive and sometimes people don't like it. But NAC is much more affordable and it's very effective. And again, it's this precursor to glutathione. So that's why NAC is really effective when it comes to congestion and breaking down mucus and being a powerful antioxidant. Okay, so other antioxidants are all good nutrients. So vitamin A, vitamin C, vitamin E, and a good one that a lot of people may have been hearing talking about when it comes to immune modulation is also selenium is really important. And where can you get selenium from? Eating a Brazil nut. One Brazil nut a day, you get a good dose of selenium. And then anti-inflammatories. So some of these guys, these three I'm going to mention, they're also antioxidants. So they have the two punch here. So they're anti-inflammatories and they're antioxidants. Turmeric, quercetin, and bromelain. They can really help to calm down the inflammation and give you the antioxidant support that you need. If you're being on good omega-3s also help to decrease the inflammation. So there's great ways that you can get your omega-3s from nuts, and there's plenty of, supplements that can do that. It was turmeric, quercetin, and bromelain. Okay, are the anti-inflammatories. And vitamin D is also vitamin D is beyond a vitamin. Vitamin D is a hormone. It's so essential to so many processes in the body. And it also has that anti-inflammatory effect that we need. So knowing what your vitamin D levels are essential, and making sure that you're taking the right dosage of vitamin D for you. Rule of thumb is to know what your vitamin D is. If you are below 60, you are deficient in vitamin D. That's not an optimal level. You want to be between 60 to 80 on your labs. If you are below 60, for every 10 points below 60, taking 2,000 IU a day will get you up to where you need to be, and then recheck your vitamin D levels in around 3 months, okay? And make sure that you've gotten it up, and then go back to a maintenance dose. Vitamin D is fat soluble. You do not want to be taking more. A fat soluble vitamin, if you take any more, so fat soluble vitamins are A, D, E, and K. If you take too much, it becomes toxic, and that is not what you need either, because that creates havoc on the body. So you want vitamin D at just the right level. You don't want to be taking vitamin D at a high level for a long time. That I see, if you have vitamin D that's too high, that's also a problem with the body. So it's always about balance, right? Okay, really important. Expectorants. So this is where I love, has anyone ever had tinctures? Tinctures are really great because you can combine different herbs for all different purposes. Sometimes they don't taste that good, but we can try and make them taste better for you. But so expectorants, so there's soothing expectorants. Hi, Nancy. So again, it depends per day. It really depends on the person. You want to know your vitamin D level, and you want to be taking the vitamin D that's for you. So you want vitamin D between 60 to 80. For every 10 points below 60, so let's say, for example, someone has a level of 30 vitamin D, you want to get up to 60. So you want to take 6,000 IU, right, to get it to 30. So 30, 40, 50, right? You want to take 2,000 IU for every 10 points you are below 60. So someone who's at 30, you want to be taking about 6,000 IU per day. It's a fat-soluble vitamin, so you take vitamin D with food. You retest in 3 months to make sure that you're right where you should be, and then you take a maintenance dose of 2,000 IU a day. But make sure that you get to the right dose, okay? Very important. So soothing expectorants are very relaxing. So if you have an irritable cough, and you're having some spasm, and these soothing ones, they thin the mucus, so you can try and clear the mucus. Peppermint's really good, licorice, fenugreek, marshmallow, but not like marshmallow. This is marshmallow, the herb, Althea officinalis is what it is. Plantains, coltsfoot, those are all really soothing. And something called pleurisy root. Pleurisy is amazing for the lungs. It also helps promote sweating, which can cool off the body, and it's anti-spasmodic, and it also helps with indigestion. So a lot of these herbs, they have multiple benefits to them. I'm just listing out how this benefits the lungs. Stimulating ones are inula and licorice. Again, so licorice can kind of do both of them, which is awesome. Something called hyssop and lobelia is really powerful, and that's stimulating, so that gets the mucus going, and it has that effect to get it up and out. Okay, so soothing kind of calms it down and thins it, where stimulating has that opposite effect. Then there are herbs that are tonics for the lungs. So they can do, when you take it, the body knows if it wants to use it as an expectorant, or if it wants to use it as, if it wants to be used as a soothing or relaxing expectorant, or if it wants to be used to stimulate it, which is really cool. So it's cool that the body knows what to do with these herbs. And again, licorice is kind of that savior there. So it can be a tonic, and golden seal also. So it's really great for the lungs in terms of if you got that congestion and you don't know if you want to relax it or stimulate it, if you're unsure, take some licorice and golden seal for a little bit, and that should help you. Okay, be careful with licorice though, because it could increase blood pressure. So again, this is why you want to have a doctor who understands herbal medicine and is trained in botanical medicines, of which ones are right for you. Okay, there's also ones called linguisticum, also goes by the name of OSHA. It's really great for bronchial infections. It's antibacterial and antiviral, great for sore throat, cold and flu. OSHA, it moves the qi, it alleviates any pain, and it expels wind. So any kind of, in Chinese medicine, exterior wind attack kind of comes on acutely and strong, and it's quite the force. OSHA is really good at expelling it and purging your body of it. Lungwort's another great herb for coughs and colds and decreasing any kind of fluid retention. So then grief. So grief settles into lungs. So the time, and I've talked about this, if anyone's heard any of my lectures with acupuncture and sleep, I talk about the time of the night when you wake up. So the time that is, so our qi moves through our body in 24-hour cycles. Every 2 hours belongs to an organ. And that's when, during the circadian clock rhythm of the 24 hours, is when the qi, the energy of that organ, really shines. So when it comes to the lungs, at 3 to 5 a.m. is where the lung qi works. So if you notice that you're having problems with sleep and you're waking up between 3 to 5, think about supporting your lungs in all the ways that I've talked about, everything with nutrition, everything with the lifestyle, sitting in a salt cave, all that stuff. And then there's also something to think about when it comes to grief. So when the lungs are out of balance, one of the emotions that come out and that people feel very heavily is grief. And when you think of grief, you can think of loss, any kind of loss. It can be loss of a loved one, which is what most people think of, loss of a relationship. Also think of changes. So a change in job, a change, you've moved. There's grief that goes along with that because you've made changes. So now you're there might be a missing or a longing for what your life was like, and now you're adjusting to your new normal. Think about what's going on now in the world. We are adjusting to our new normal. We're kind of grieving the life, the things that we used to do. And also the silver lining with all this, hopefully we're having a new appreciation of the lives that we did have. And we're longing for that. So a lot of people are affected. I know I've actually been waking up really early lately, around 4 and 5 a.m. So I think in some ways I miss it. I miss going into the office. I miss seeing everybody. So I know that I'm getting affected, in this way. And I'm sure that other people are experiencing this as well. But something to think about. So any kind of grief, and understanding also, when it comes to this, and trying to explore emotions, understanding self-talk. Is there something that you're saying to yourself? Is there underlying things going on that you can help support your emotions? And understanding that self-talk, being in a safe place, talking to somebody that you trust to explore this is the way to go about it. But self-talk is automatic. It's often been something that we've been saying to ourselves for a long time. It might be so innate to us. We're just so used to it. It might come in the form not only of words that we say to ourselves that are so automatic, but it might be an image, and we're constantly seeing something over and over. And with that, it replays a story in our head. So self-talk can be really powerful. And it's not just turning the negative self-talk around and just say something positive and it's all over. Oh, boom, I feel better. You have to really understand where this came from and what's going on. So if that self-talk is negative and there's more to it, that to understand, I love talking about this because it brings awareness to it, and it's something to think about if this is part of a picture with any problems with lung health. Because sometimes it's not all physiological. This can happen. You go to the doctor, they might even do the pulmonary function test and everything's fine, but you feel like you just can't breathe right. What could be going on? Could it be something emotional? Is there the emotional aspect to it? And is it grief? So there's ways that naturopathic medicine does it. So, talk therapy helps. I love to use some beautiful remedies called Bach remedies. They're flower essences, and I make preparations that are specific to each of my patients. There's also Bach remedies. You can get them at CVS, and you can get them around. There's little lozenges that you can buy. Those are really great at calming stress, calming down any anxiety. You take them when you need them. You don't really take it prophylactically. You don't just take it every day, but you have it on hand. When you need it, you take it. I make these, beautiful Bach remedies for my patients to take when they need them. They're really wonderful. And homeopathy can be really effective also. So many ways of looking at grief, and trying to overcome it so that you can feel better, so you can breathe easier, so you can sleep through the night. When you do all of these things to bring balance back to the body, you really do feel that sense of relief. And I can say from personal experience, when I had my mild obstructive lung disease, I also have had, another bout with autoimmune disease. When it comes to chronic illness, you have to, like I was saying, you have to be your own health advocate and find answers and find out what's right for you. Everybody has a different path. And finding someone who can help you on your own path is really important. But you do come out the other side. Okay, so you do come out with all this knowledge about yourself, an understanding of yourself. It doesn't have to be a battle. I encourage, if anyone's going through any health conditions, don't think of it as a battle and a fight. Think of it as an opportunity to learn, to be your best self, to give you the nutrients that you need, and find out ways to help yourself. And it's just the gift that keeps on giving, because you end up sharing what you've learned for yourself with your loved ones, and other ones get to benefit from what you've been able to do for yourself. So another thing that I love to work with patients is daily affirmations. So see if I can find my, so Louise Hay, I got this. I was introduced this book from my good and dear friend, Dr. Kathleen Cannon, gave this to me while I was in med school. And she introduced me to the wonderful world of daily affirmations. And daily affirmations, if you're a patient of mine out there, you know that I use it for just about everybody, as long as I know it resonates with them. And it's words that will empower you to take your health into your own hands to feel better. And they really are powerful. You say these affirmations, a phrase that resonates with you, that you believe in, and you say it ideally in the mirror every day out loud to get you through and bring your balance back to the body on your healing journey to feel better. So now I know that we are over time. It's supposed to be a half hour, but it's an hour. That's okay. I think everyone is still hanging in there. So let us see. I know that there were a few questions, and I'm trying to go back in here because there are actually quite a few. Okay, so let's see. Eggs. Yeah, I'm a big fan of whole food, plant-based diet. So, there's lots of things to consider about with eggs, the treatment of the chickens. There is a higher protein load in them. But the best way to get your vitamin D, I see in this question, is from a supplement. Optimally, you want to get it from the sunshine. Living on the East Coast, we're not privy to it right now. We're getting into the season, but if you don't get your daily exposure of it, then it's really tough. It also depends on our distance from the equator. So getting it from a quality supplement, making sure your vitamin D is at the right dose, and taking that with a good fat in a meal is good. Filtration systems. So so no plastic bottles, right? That's a load of toxicity in your body. If you drink plastic water, you're from a water bottle, you are drinking plastic water. That's what it is. So filtration system. So I use the Berkey system. I love that. You can put it on a counter and you keep refilling it. And I love that one. Reverse osmosis. Some people love our reverse osmosis. So people have different, experiences with what's best for them. And I know that having quality water is really important. Oregano oil. Yes. Oregano oil is amazing, antiviral, and it's powerful. So, and I love using oregano as an herb. In fact, I just got some fresh oregano oil the other day and I was just kind of chomping on it, and you can just eat those leaves, right? And you get it just as food. The neti pot. The neti pot's great, but no distilled water. Can I boil it? Yeah. So if you want to boil the water and then bring it down to room temperature, you could try that. You might want to email me if you have any more questions with that neti pot. I'd rather. I'm not sure exactly what you're asking that question. So if you want to shoot me an email, then I can follow up that with you later. Both forms of eucalyptus are great. I like both of those. So essential oils, I wouldn't add them to teas. So essential oils, the ways that you want to use it are the ways that I talked about it. You want to have teas like the ginger and cinnamon, but getting that from food or a quality tea bag, an organic tea company. I would not add essential oils to teas. They're very strong, and I wouldn't do that. Rule of thumb, you can think any essential oils that are named after a food, for the most part, those could potentially be safe, but I wouldn't just add them straight to teas, and I would use a lot of caution with ingesting any essential oils. I would definitely, if you want to email me, I could send you some links of people that specialize with essential oils, and they have a lot more information than I can give you. And they can tell you which ones are safe or not, which ones are safer for kids and things like that. So I'm happy to send you that if you want to shoot me an email. And again, my email, if anyone doesn't have it, you can go to innersourcehealth.com. My email is drdawn@innersourcehealth.com. Feel free to shoot me an email and I'm happy to email you back. And yeah, so I think that's it. I think that I was able to get to all the other ones. And
Thank you,
yep.
Dr. Dawn. That was
Okay,
amazing.
yeah.
That was a tour de force, a pulmonary de force.
Yeah, I tried to get it all in there, so
Well,
I'm
thank
happy
you
to
so
share this
much.
information.
And thank you everyone for staying with us. Um, uh, I would like to also invite you to tomorrow. I will be speaking about how to deal with anxiety and mood issues during this time as well. So I think, unfortunately, this is bringing out a lot of anxieties in all of us and some depression, and that's something we can certainly work on. A lot of the things Dr. Dawn talked about today would be wonderful as well for mood, and I'll be talking about a number of other things too. So thank you, Dr.
All
Don,
right.
for being
Thank
here,
you. Thanks,
and thank
Peter.
you to all the participants who attended. And this is being recorded. Hopefully, we'll get this put up soon, and we'll let you know about that as well. So it was a pleasure to have everyone.
Okay, great. Thank you. Bye, everybody. Thanks for joining.